is equally valuable and therefore equally worth saving, how should limited resources, medical resources, be fairly distributed? I think we broached this to a degree, but what do you say?
How many hours do we have? It seems to me that is an extraordinarily difficult issue. It's a particularly difficult issue in the context of state healthcare systems. Of course, in the context of private healthcare system, these decisions are made without a central reflection on how you allocate resources. I think, of course, in the context of systems in which you have a pot of money and you decide what we're going to give to immunizing children and what we're going to give to taking care of people with kidney failure and people at end of life, I think these are immensely complex decisions. And I think at one level there's no obvious right or wrong answer, save to engage a moral community of persons who understand the situation professionally, who are physicians and who are nurses, who are patients, into some sense of how we apportion our resources. It's one level, it's the same question. I mean, how do you spend your time if you're a father or a mother and you have to earn money and spend time with your children and look after your aged relatives and help with community groups in the village? I mean, these are all apportionment decisions that we take all the time, typically intuitively, and my response, I think, will be underlined by the comment that if we lose our broad sense of the fundamental dignity of all human life, we lose our capacity to make those intuitive decisions. And we get involved in utilitarian sort of calculus, ordering points, numbers, how we assess this versus that. The intuition of the moral community, on the basis of our common vision of the dignity of every individual, I think is central to our being able to make any kind of moral sense of those decisions.
Let me follow that up with another related question for you, Dr. Cameron. Given your respect for all human life, what is your answer to the overly burdened family of the severely disabled individual? What is your answer for caring for individuals who have no caring family?
Well, of course, an easy answer would be to say the state should provide more resources, or the community, Christians and others, should be more helpful, and such things. It seems to me, though, that the question you raise is that of whether we are able in this world to guarantee persons a certain degree of happiness and sustenance, and we are not. Because we live, Christians believe in a fallen world, we all acknowledge in a world full of disorder, and we have no way of answering the tragedies of individual lives in a way that can guarantee that people can cope with them. I think, however, we as individuals and as communities plainly have extraordinary moral obligations to aid one another at times of crisis and tragedy. And that is an experience which, of course, the September 11 events, I think, have brought home to many people. That we are one global community, we're certainly one national community, and we should be much more concerned with what we can do individually to help others, as well as with devising systems of support which are more able to help them sustain their lives. But we live in a world in which there are no such guarantees.
Well, we've now come to